Hey, everybody. Today we are diving into the topic of dancing at college. So I am talking to one of my friends who is the athletic trainer for George Mason University's dance department. And we are chatting a little bit about what it looks like to stay healthy and be able to dance at that collegiate level. We're going to talk a little bit about types of injuries that she is seeing at this level, as well as some general tips and preventative measures to make sure that you are staying healthy when you are at school. So this is perfect for anyone who is either looking to start a program in the fall, will be going away to college, or if you're already in a program that you'll be returning back to. So I hope that you enjoy, and as always, let me know if you have any questions. You can leave them right in the comments below. All right. Hi, everybody. Jena here from Pointe Wellness, and I am interviewing another Jena today. I'm going to let her introduce herself. So Jena, if you want to take it away, just tell us a little bit about yourself, who you are.
All right. My name is Jena Hanson-Honeycutt, and I'm the athletic trainer at George Mason University School of Dance. And so I am responsible for the health and wellness of about 80 majors at George Mason. I'm originally from the Northwest, and I went to school out there. And I would say in the beginning, I would say I didn't know about dance, and I did soccer and traditional sports, and then in college, my first exposure was working at performance with my professor, and that's what actually ever made me interested in working with dancers. I think they're wonderful.
I never know that about you.
Yeah, yeah. Most people think, oh, you're interested in dancers, and that's why you danced, and I'd never danced. So everything I've learned about dance has been from dancers and not firsthand. Never experienced the culture. I thought I would work traditional sports.
Yeah, that's awesome.
Yeah, it's been a great path, and I've really loved it and clearly stuck with it. So
absolutely, dancers are fun to work with. I will definitely agree with you on that. So today we thought that we would chat with you guys, and I'm going to interview Jena. So since she is the athletic trainer at George Mason, I thought I would ask her some questions about how you guys as dancers can best prepare if you are a dancer that is either getting ready to go to the college in the fall or near future, or if you're already in a university program, kind of get her take on, what are some common injuries she sees? How can you stay healthy in that arena? And just get her take on all of that. So, Jena, can you just tell us a little bit, what are the most common things that you kind of see in that university setting? What are the injuries you're treating?
So maybe I'll describe kind of what the life is like a little bit.
Yeah,
of
please.
of the dance majors. So whatever university you picked is going to be a little bit different, but for us, typically the dance majors are dancing 20 to 25 hours per week of technique and rehearsal. And then they also sometimes have choreography classes on top of that, or improv classes. And that's all pushing them closer to maybe 30 hours or something like that, of 20 to 30 hours of physical activity a week. So you see it across the board, professional, collegiate, and then pre-professional dancers are all most likely getting the overuse injuries. And it kind of makes sense with how much they're dancing, that's just what I tend to see.
Absolutely. It's a lot. It's a lot of hours.
It's a ton of hours, and you think, well, I did school and then I did studio after, and I was completely prepared. But I think realistically, the teachers ask something different of you at the college level, to explore the artistry and the quality of the movement a little bit more. And so if you continue the bad patterns from your pre-professional training or from the studio training, then that kind of gets magnified because of the hours at the collegiate level. So I would say listen to the professors and then listen to whatever healthcare provider you have at this setting. Like mostly I'm seeing like low back, hips, knees, ankles, with either like chronic strains or then maybe some then acute sprains every so often. But most likely we just don't have the traumatic injuries where it's like, oh man, I did this and I broke this bone. Most likely we just have maybe one of those a year. So it's very few out of the
Oh,
80.
wow. Yeah, that's a lot lower than even I would have thought. So that's a good thing, I suppose.
Yeah. I think it's like the teachers teach how to move a little bit better. Like usually when you enter into the curriculum, they have a couple teachers that they know are going to help correct some of those patterns, so that they really try to set you up for like success in the next 3 years of how you're going to move. So I would say listen to the cues because they're asking you to like not work so hard. Maybe take your leg just like an inch down so that you can feel the correct muscle firing rather than looking so much for what the height is on the leg or certain things like that. They're looking for you to improve like strength and control and uh, making sure that you're not like using um, the wrong muscles for like extensions and things like that. So it's
Yeah.
that's about what I see.
Do you think that just from like the teachers that you work with, do you feel like they have a little bit better understanding? And I don't necessarily know what the background of all these teachers is, but do they have more of like that anatomy background and maybe more than you would get at a studio when you're dancing in high school?
Yeah, I think so. Most of our faculty have done like a pretty long professional career and then have transitioned into teaching. So they I think they recognize the demands of like, well, what does a professional career like look like, and what are they going to ask of you?
Mm.
And then they take that, and then they've done a lot of study on their own. I think of like, well, how does it feel when I move like this, or what about this, or like somatic classes or anatomy classes, and trying to learn different techniques of uh, like one of the teachers that I can think of, like they think a lot about like weight shifting and sharing and like when you're doing partnering and making sure like the grips are right and things like that. And then like how you interact with the floor. And so like they're thinking about like the mechanics for all those positions, which is like really nice because sometimes we think, oh, the teachers aren't maybe thinking about those things, but I think my faculty for sure are thinking about like, okay, you might have not had like, for example, I don't see that much upper body injuries just because the load's so low. But if like a teacher, one of them, for example, they like really work up the strength building before they start maybe doing some of the floor work. So they really design their classes, I think, nicely, and are trying to figure out like, I want to teach these students this semester, and then they build on that, and then each class is going to receive kind of different lessons, and then overall that kind of adds to the rehearsals, and they can take that into expanding what they're trying to do and explore a little bit more on their own.
That's awesome. I mean, I would hope that most programs have that same kind of structure where they're doing a lot of that like strength and conditioning type stuff. I think that that's so important. Um, and dancers don't always know how to do that on their own. So they really need that guidance.
Yeah, I agree. It's like for example, I teach the anatomy and kidneys class, and we were discussing like strength and conditioning protocols, and they're like, wait, I don't understand how to do this. I'm like, this is exactly why we're learning it, because then you can kind of see like, oh, my teacher does this because of this, and then I can understand like they're not just asking me to do this exercise, the next 4 times for their own pleasure, but they're doing it so that then I can get some benefit out of it. So
Yeah.
they take a step back and look at it. They're like, oh, the teachers really do know what they're doing.
Right. Well, that's good. Yeah.
Mm-hmm.
Yeah. So it kind of gives them the why, which I think
Mm-hmm.
for anybody, like dancer or not, when you know the why, you're much more likely to carry through with whatever it is, strength wise, conditioning wise. So that's important.
Yeah, I think it's really important. It's
So,
nice
so
to see
you,
it emphasized at the university.
yeah, absolutely. So you do the like some strength and conditioning discussion when you teach the anatomy class. As an athletic trainer in the department, do you do any strength and conditioning with your dancers that way?
Yeah, so at George Mason, we do screens on all of the dancers individually, one-on-one with me, so that they can talk to me and address like the concerns they might have. Like, oh yeah, and when I was working in the studio or at the previous performing arts high school, then I was like having a lot of like low back pain, and so I kind of understand the history, and then so I can work on like, okay, well, what are hips doing? Are they maintaining the motion? What does it look like? Here's some specific things that I need you to do so that we just don't get to the place that we were. So it's a pretty lovely bonus of like the time I'm allotted of like, I get 45 minutes and then I ask a couple follow-ups from them. So the goal is like after the initial meeting, you bring back, in a month, like what are the teachers asking of you?
Mm.
And then what am I going to ask of you? And then what are your goals so that we can like make a nice little plan for 4 years of like where you should be at the end.
That's amazing. That's such an important like progression that you want to do, like making sure that you're including like what are their goals, and then like from your standpoint, here's where you're at. Like that's such a great partnership, it sounds like.
Yeah, because I mean, they could tell me that they're interested in balance, and I could be like, well, I'm pretty interested in this upper body stuff for you. And they're like, like if there's a little give and take,
Right.
a little bit better, you're like, okay, I'll do the couple push-ups or, these exercises for the balance exercises. So then my skills get better on the floor or in ballet.
Absolutely. So from that kind of both the assessment and the strength and conditioning aspect, do you find that the dancers tend to be pretty motivated towards sticking to those plans?
Yeah, there's only a couple who are like, I'm not sure if you understand what I want to do. There's like maybe one or two out of the
Mm-hmm.
class, but they usually come around in the springtime. So
Oh, that's good.
uh, I think it's just like overwhelming. Like, oh, I should do all these things. And I think the faculty, we all recognize like it's just an overwhelming transition. So
Mm-hmm.
I'm giving these few things to help you in the meantime, but recognizing that this is a longer like plan that we're going to have to sort out for you. So yeah, most of them, I mean, if you want to go to college and dance, I think you're already motivated. You've already been doing your classes and your exercises and working on your skills. So I think it just comes naturally to them.
Yeah. I think, for a lot of, a lot of the dancers, that I treat are getting ready to go to college in the fall, or hopefully in the fall. But I think, if you have any advice or tips on like, they're making this transition from maybe having some external motivation. They've got their parents are there, their friends that they know and that they've danced with already. It is a big transition going to a new school without that maybe external motivation. Do you have any like tips or suggestions to make sure, like, what would you tell a dancer, like why do they need to adhere to these things that you're trying to tell them, both assessment and strength and conditioning wise?
I usually relate it to like maybe what they feel in class. So, like for example, they get the correction in the cumbre back or something to um, like lift more from the sternum or something like that. Well, if you don't have the appropriate like thoracic mobility, it's just pretty hard to do the cumbre right. And so they might be sinking into the low back and then complaining of some like low back pain. So it's like, well, if you do this exercise, it should make this feel better. So then like we kind of relate it to the like how they feel in class, and I think that helps. Um, just trying to see like, okay, this exercise, like for example like bridge work or something like that, makes the standing leg stronger so that then you're like moving your gesture leg gets higher. And
Mm.
you can kind of like relate those. I try not to just be like, just do this because of this, like,
right.
because otherwise you're like, well, why would I do that? That's a crazy
Yeah,
exercise. It's a
that's so
bridge on
true.
the floor. It's like so easy. Why would I do that? I'm like, well, you can't really hold it for that long. So maybe we should think about like, you can't hold it for that long. So then that means maybe your leg can't be up for that long, your gesture leg. So
Yeah. Yeah. I mean, I think making it real to them, that's just like such a big piece of it, is how do I make this real? I mean, it's the same, obviously, when I'm treating a patient for PT. You have
mhm.
to make it kind of applicable to whatever it is that they're trying to do. Yeah. Um, so, I mean, so you said most of the injuries that you're seeing are like overuse type injuries.
Yeah.
So do you have a hard time? Because I know, like for me, I struggle with this when I'm treating patients. Kind of, how do you, like with periodization? So if you guys don't know what periodization is, it's basically adjusting your workout schedule at different intervals and times in the year to make sure that you're not overworking and overusing, certain muscles, or you're not fatiguing and burning out. Do you, how do you find, in the university setting, do you struggle with that periodization and trying to get them to do a strength program while they're doing such an intensive class schedule?
Yeah, it's pretty hard. It's just so much easier, I think, in athletics because you really have like one head coach who oversees all the programming. Where, like I said before, I think it's kind of wonderful we have all these teachers teaching these different skills. So really, this I have to kind of be aware of what this person's teacher's schedules are and what it might be like in their class, and try to adjust some of their other strength and conditioning maintenance program to like suit those needs. Because if I know you're having like a pretty heavy ballet-ish semester, then I'm gonna probably decrease some of like the hip flexor exercises or stuff like that, that maybe you had on the side in the beginning, because you're gonna get it in class. And so sometimes you don't just recognize what the teachers are giving you because you're paying attention to other things. So if I have the foresight of like, oh, this stuff is starting to bother you, okay, let's balance it out by adding in more posterior chain exercises so that we can maintain your level. um, I think that's helpful, but then also I think it relies a little bit more heavily on the dancer to look at like, okay, what does my weekly schedule look like? What rehearsals did I choose? And then, what days am I choosing to do like cardiovascular additionally? Or what days am I choosing to do upper body? Like if you're like, with the periodization, like you should have hard days. So,
Yeah.
if you add in an extra little strength routine on top of the day that you have rehearsal, now we had a really wonderful hard day. And the next day we can, back it off and make it a little bit more imagery based or something like that to try to fluctuate the in week schedule so that hopefully when you get to the heavy weeks of dancing, like a show week, then it's just like a natural progression.
Yeah.
But
Okay. That definitely makes sense.
so we have like a little bit embedded, like of like a harder week when we come to shows, but those are closer to the end of the semester. So it just like tends to build, and then spike. So
Sure. Yeah. I can't imagine that it is easy, because I know I have a hard time helping dancers be able to do that. And they're not dancing, nearly as many hours as a university dancer might be. So one of the biggest struggles with dance medicine, I think, and there's no break, like there's no season, like it's just constant all year round, or fairly constant. So
I do think the teachers recognize too, like, okay, they had a show last night. How can we make this class the next day not necessarily like a break, but like more restorative so that like your body takes in the information that it's getting. And they do a good job of really trying to emphasize those variations of the schedule. Or like, the other thing that kind of like throws everything for the I guess the windows to make a little tornado or something, is when they have like midterms or finals like on
oh,
top of, so like the academic coursework sometimes also really disrupts the dance schedule. So maybe that's when you're like, okay, how can I, adjust, the mental and the physical load. So we had to kind of consider those things too.
Yeah, that's a really good point. Didn't even think about like, yeah, I mean, the stress, the probably lack of sleep, if I had to guess, nutrition. I mean, all of those things for just a college student in general are such a challenge.
Yeah. You had mentioned like, oh, what do I think they should do? I'm like, they should sleep during the semester. Like I know you're a freshman, I know you want to have fun, but please sleep.
Yeah. Well, we know
Sometimes.
that there's more injuries when people are not well rested. I mean, we know that for no matter what your sport or activity is. So mix that in with like midterms and probably cramming and studying and whatnot.
Yeah, that's when I like if they do have problems, I think, it's your first semester at college, you think the professors are scary. Like you've taught, university courses, I've taught university courses. Like we understand that
Yeah.
there's sometimes extenuating circumstances and you have to just talk to the professor about like, what can I do? How can I get through this so that I meet your expectations, but then also like don't just like drown myself, because it's just hard to pick yourself up out of that hole. So just early
Yeah,
communication.
absolutely. So like in your role as an athletic trainer, do you discuss a lot of that with your dancers? Like, will you go into nutrition and stress management and that type of thing?
Yeah. There's a couple who come in and you can just tell like, in the history, like they've dealt with stress and like it affects them on certain levels. And so that's when it's maybe time, like you didn't learn good coping skills in high school because it was just a lower threshold. And so um, I can offer like the beginning of like the stress management stuff, but I also would say like the counseling services on campus are great. They are pretty familiar with what's needed for college students. So the dancer is a little bit different, but they're also pretty useful most of the time. Um, and then I try to outsource for resources for nutrition. Sometimes I can give like basic stuff, but otherwise I try to say like there's actually a registered dietitian on our campus that allows for personal visits. So understanding like how the dining hall might like how to choose better foods at the dining hall so that you
Mm,
get the nutrition that you need for how much you're exercising, stuff like that. So it's a good
yeah.
resource, and people just don't realize that they're usually on campus, and that's kind of the blessing of a dance department. They usually know how to find those good resources.
Absolutely. Yeah. I mean, the nutrition is so huge for every dancer. I still have yet to find, you have to let me know if you know of a good one in the area, because I don't have a registered dietitian or nutritionist or anything that's familiar with dancers that I refer to in the area, because I don't know of one. So you have to let me know if you have a good one.
I will.
Yeah. I mean, it's so important for any athlete, to make sure that you're getting, with the amount of calories that you're burning. Um, that's so important. So yeah. All right. Well, so, I mean, do you have any, ideas and tips for dancers that might be getting ready? I know right now we're kind of going through this whole pandemic situation. So things I think are a little bit different than they normally would be. But a lot of dancers are preparing to go into a university program we're hoping the fall. We don't really know when that's going to be. But at some point they will be going in, back to school. What advice would you give them for like, how best ways to prepare to prepare their bodies now so that hopefully they are lowering their risk of injury or burnout when they get there?
I think the teachers are going to be pretty aware that like the loads have changed on the dancers. So I think the beginning couple weeks of classes you're going to see different modifications to build up to like the jumping load that you
Mm,
used to maintain. Like I think Grande Lego, I could just imagine being less of, and then a little bit more petite for a couple weeks and to build up the strength for the Grand. Um, and like just like the bone impact, time over time. I would say like I was thinking like, during like pre to it, I would say mostly I give like hip and balance of some sort of exercises. So maintaining like the hip strength,
Mm-hmm.
like in a variety of exercises, you can safely most likely do some jumping activities outside with good shoes, and you can kind of still maintain some jumping impact. Um, so I'd say those are probably some things to like help prevent lower leg and low back stuff. Keeping your mobility, like making sure you're maintaining all that motion that you did get and that you can control all of it. You don't have like one leg that you can easily get, your 30 degrees of hip extension, and the other side it's like stuck at 15. Like we really want to make sure that that's normal side to side. So it's kind of like on you to maintain those little checks of like, okay, how do I feel? Like, is something really off? And if something's off, then like, how do I fix it? Either seeing you for an appointment or seeing the local physical therapist that they're probably have on speed dial. So
I hope so.
I would say like those are pretty, those are pretty like basic things to do. I was talking to some of our freshmen after class the other day, and I was thinking like if it's like feasible for you to pick up a couple like self massage tools
Mm.
for your dorm room, because I have tons in my conditioning lab, but sometimes you get done with rehearsal late at night and it might be closed. And if you can have something in your dorm room that is just like maybe a little small spiky ball for your foot, or they were saying heating pads and ice packs. I don't really ever advise those, but they said that it makes them feel better. So I was like, well then, maybe you use a heating pack to help you relax a little bit at night. Or
Yeah.
I sometimes will give breathing exercises to help you kind of calm down, since you're exercising kind of so closely to bedtime. How do we help the body shift into that to get a better night's sleep?
Yeah, love
I
the
thought
breathing
that,
stuff. Love the
yeah.
breathing.
I have a couple students. I know that like essential oils, like it's kind of just like, okay, what can you bring from home that's pretty familiar that would make you feel a little bit calmer or relaxed at the end of the day, so like you feel like you're getting the full restorative benefit of the sleep and the recovery that we need you to get.
Yeah, absolutely. Yeah, that's a great point about, what's familiar from home. I'm sure that helps with the stress management a lot too, just to have that familiarity. So I know I have my basket of like mobility tools that sits right next to me like all the time. I've got my foam roller and my massage stick and like tennis ball and all that stuff. And this is like, I tell my dancers the same thing. I'm like, keep it somewhere that's really accessible to you so that you see it. Like put it in front of your TV or something so that you see it and you remember to do it. Whatever is going to give you that reminder.
So the other thing I would say that my dancers were saying was to like know when to not muscle through. Like if you're tired, like, it's not necessarily going to help you if you just keep beating against like something that your body's fatigued out of. So recognizing like to ask whoever you have on campus for help. Um, I was going to say, some dance programs have someone in-house like I am so closely. And then just some dance programs, maybe the athletic trainer or PT is only there like once or 3 times a week. So I would say get acquainted with whatever services the dance program's offering pretty quickly. They'll know. And I have a friend up in New York. She actually works in athletics, but she sees all of the dancers. So, it might not be like kind of clear where to turn to for help, but I would say just be on the lookout and then ask them like, okay, how do I modify this so that I can keep up in class?
Yeah,
Because we're
that's
going to have
a good point.
ideas.
Do most programs, do you think, do they have somebody that, I don't know, like, do they have someone that's like specific to the dance department, or is that unique, do you feel like, to your to George Mason?
I think it's pretty unique. I would say I like it depends on if it's like full time, like a full
Mm-hmm.
time athletic trainer or someone dedicated to like, you know, strength, you know, the injury evaluations, injury prevention, and then treatment and rehab. I think, you know, to be full time, that's pretty rare. I think a lot of schools have someone to reach out to. For example, like I know there's a school in Virginia that also they mostly refer out to a PT clinic, and that's the way they're going to be able to get the like the information or stuff that they need. So um I would say I think out of the 350 like dance programs we have in the United States, I think probably there's like 20, you know, who have full time.
Oh, wow.
um so like, and then, you know, part-time, that's like maybe a PT coming in twice a week or something like that. It just depends on, I know a couple of universities who just have an orthodoc who
Mm.
comes to visit, you know, a couple times a week, or, you know, that's who they refer to mostly. So maybe it's not so much the physical rehab stuff that they would like. So just scope it out early. Sometimes, you know, athletics helps out. You just don't know. Like I know, for example, UNC's Chapel Hill, like actually all students are able to see their athletic trainers on campus. So
Oh, okay.
you just have to kind of be like savvy in finding out who can help you. They might not have experience with dance, but if they're familiar with athletics, then I'm pretty sure they know how hard your workload is. And if you just kind of, you know, teach them or show them the motion, then they're going to be like, oh, I understand how you want to do that. Here's
Yeah.
maybe some things to do that. So it's, I mean, that's how I got exposed to dance, was somebody was willing to teach me. So
Right.
maybe you can be the person to teach them.
That's great. Well, it sounds like you are in a pretty cool position then. George Mason is doing a good job with dance medicine.
Yeah, we're trying. We're making sure that they get the care that they need, and we have a nice referral network in the area too. So if there isn't someone in house, then I'm sure that they have a good referral network for, you know, everything from registered dietitians to counseling to PTs to docs to ATs. So
Yeah, absolutely. I'm trying to think, can you hear my son screaming up there? That's why I have headphones in.
just a little bit.
Yeah, he's screaming. So if you hear that, that's what that is. My husband was supposed to keep him quiet, but he's not doing a good job. All right. Well, I think this was awesome. Hopefully dancers find this really helpful. Like I said, if you're somebody that's preparing to go to college, or thinking about it, or if you're already in a program, I think all this information is just really good to hear. And so, yeah, I mean, thank you for chatting with me a little bit today. We'll, I'm trying to think if there's any resources or anything I can add that might be helpful. I can put them down in the comment section too. So if you have any resources that you think might be helpful for dancers, just send them to me and I'll stick them down in the comment section.
Okay.
All right. Awesome. Okay. Thanks, Jena.
All right. Yeah.
Bye.